EVOLVE is a phase 1/2 trial of Orva-cel or Orvacabtagene autoleucel, which is a BCMA-directed CAR T-cell product that's been developed for patients with relapsed and refractory multiple myeloma. We previously presented at ASH 2018 the results from the earlier dose cohorts of 50 and 150 million CAR T-cells. And here at ASCO, we're presenting results from higher doses of 300, 450, and 600 million. And we are presenting results from a total of 62 patients who were treated in this study to date, including 62 patients who were treated on this study. As I mentioned, this is a phase 1/2 trial, and Orva-cel is a BCMA-directed CAR T-cell product that has a fully human binder, and the manufacturing process is optimized to enrich for a central memory phenotype, which we think will help with more persistent, more effective CAR T-cell product. So this was a study that involved patients with relapsed and refractory multiple myeloma. Our patients were heavily pretreated. The patients had received a median of 6 prior lines of treatment and had received all available or most available standard treatments, including proteasome inhibitors, immunomodulatory drugs, CD38 antibodies, and autologous stem cell transplantation. About a high proportion of our patients were penta-exposed, more than 90% were. And about half of these patients were also what we define as penta-refractory, that is refractory to at least 5 different drugs that are commonly used for treatment of multiple myeloma. As I mentioned, there's a total of 62 patients in this study. Patients were treated at doses of 300, 450, and 600 million. Regarding safety, we do see kind of the anticipated side effects that come with these treatments. So there is cytopenias are fairly common, both anemia, thrombocytopenia, and neutropenia are seen in a high proportion of patients, and in the majority of patients, these cytopenias were reversible with follow-up. The grade 3 or higher infection rate was fairly low at about 11%, and the key adverse events that we're interested with CAR T-cell products is CRS and neurologic events. And while both of these were seen in this study as well, the rates of grade 3 or higher CRS and neurologic events were both about 3%, which is pretty low. And again, were manageable with standard treatments for these side effects, including tocilizumab, anakinra, steroids that were used for the management of these side effects. With regards to expansion and persistence, we do see good expansion across all 3 dose levels. So we saw robust expansion in all patients treated at these 3 dose levels of 300, 450, and 600 million. And we did see a trend towards increased expansion across the 3 dose levels as well. Although not statistically significant, the expansion did seem to get better with the higher doses in these early time points. We also look for persistence of CAR T cells at 6 months, and of the 29 evaluable patients, 20 patients had persistent CAR T cells at the 6-month follow-up, which is about 69%, again, showing that these cells both expand very nicely in the short term, and at least in a good proportion of patients can be persistent with longer follow-up. And then coming to responses, we saw here the overall response rate was 92% across the 3 dose levels, with 68% of patients achieving a very good partial response or better. And this was seen again at all the 3 dose levels. And I would point out that for this CAR T cell, as with other CAR T cells, the responses tend to get better with time. That is, in some patients, it can take up to 6 to 12 months before we see the full depth of response. And so the follow-up on the study was only about 6.9 months, particularly for the higher doses. For the 600 million dose, it was only about 2.3 months. So we're hoping that with longer follow-up, the responses will deepen. But at this time point, at the last follow-up, the overall response was 92%, and the VGPR or better was 68%. We also looked for minimal residual disease in those patients who had achieved a partial response or better by 3 months, and 84% of the evaluable patients were also MRD negative at the 3-month time point. This is using next-generation sequencing-based bone marrow testing for minimal residual disease. And because response assessment for patients with myeloma is kind of challenging, particularly with extramedullary disease, we also looked for best response based on serologic responses for all 62 patients in the study. And every patient but one, that is 61 out of 62 patients, had a 50% or greater drop in their involved paraprotein. and more than 50% had a 100% decline in their paraprotein as the best response, best serologic response, which again is quite encouraging. And when we look at responses over time on the study, as I mentioned, we do see deepening of responses over 6 and 12 months, particularly at patients who are treated now more than 1 year. And we do have several patients who are out more than 12 months at this point with ongoing responses. And then lastly, one of the concerns with BCMA-directed therapies, including CAR T cells, is the efficacy of these cells in the setting of high soluble BCMA levels in the serum. And with this on this study, we do see response across all levels of soluble BCMA. And if we focus on in the 12 patients with the highest soluble BCMA levels, we do see that all patients had achieved a partial response or better. All 12 patients had achieved a partial response or better, and about 67% of these patients had achieved a very good partial response or better, suggesting that the product is active across ranges of soluble BCMA level, including those with very high soluble BCMA levels at baseline. So I guess to summarize, Orva-cel is a BCMA CAR T cell product that has a fully human binder and a manufacturing process that's optimized to enrich for a central memory phenotype. The product was highly active. The overall response rate was 92%. The VGPR or better was 68%. And as I mentioned, about 84% of patients that were evaluable were also MRD negative at the 3-month time point. We see robust expansions at all 3 dose levels, and the responses were observed even in patients with a very high baseline soluble BCMA levels. And the safety profile of this product it's quite encouraging, with pretty low rates of grade 3 or higher CRS and neurologic events at 3% each. And the study is now completed the phase 1 portion, and the recommended phase 2 dose is 600 million, and we're currently enrolling patients in the phase 2 portion of the study, including a new cohort for patients with prior BCMA therapies as well, that will enroll patients over the next 6 to 12 months.